Depression and anxiety are deeply painful experiences. Sadly, what I'm about to say can be used to minimize suffering, and that's not my intention. So I want to name it and issue a trigger warning. Anything powerful enough to support recovery is also powerful enough to hurt if misunderstood or misused. And the comment section is not a great place to work through confusion or frustration about this topic. If something stirs things up for you in this topic, please feel free to email me instead. If you're watching or listening to this and you've struggled for years, it's not a critique of you. I'd like to offer you an invitation to rethink a story we've all been told about trauma and healing. I often hear questions like, do you do trauma-informed therapy? Implying normal therapy is not going to work if trauma's involved. Or, if trauma caused this, won't I be stuck in the past until that's fixed? Can you help with that? Or on the opposite side, I had a great childhood. Why am I so depressed? These are honest questions, and they point us towards something that we need to talk about. Before we go any further, let's try to understand why the trauma explanation is so compelling. Why many of us, including mental health professionals, want trauma to be the cause. First, believing trauma caused depression or anxiety protects people from self-blame and shame. It shifts the story from something's wrong with me to something happened to me. And that can be profoundly relieving. Trauma explanations give suffering a narrative. It helps the pain to make sense. If there's a clear cause, then the pain feels less random and less frightening. We are naturally rational. We want to make sense of things. Trauma-based models also reduce uncertainty. This is what happened to me, rather than a nebulous series of uncertain things, leaving one to feel lost and unsure. And for many, trauma language provides identity and community, a shared framework that finally puts words to the experiences they couldn't previously name. They finally feel heard and understood, like a aha moment, an epiphany that's deeply affirming. If you find yourself holding tightly to the idea that trauma must be the cause of your suffering, that may be a sign of compassion toward yourself in such a harsh world. It can protect against self-blame and fear of putting yourself in the driver's seat. You can sit back and let the therapist do the work, and that feels right. They're the experts. They're the ones that went to school. You've already been through so much at the hands of others. It's nice to think you could put yourself in the hands of someone compassionate and skilled to help you move past baggage and hurt. Make no mistake, trauma can be absolutely a contributing factor in depression and anxiety. And we certainly want to have therapists who are compassionate and informed about how much trauma affects us. But we don't have evidence to support trauma as a cause, nor does it have to be present to have depression or anxiety. Depression and anxiety are better understood as multifactorial collection of symptoms, not a single disease entity. This collection of symptoms emerges when multiple risk factors accumulate. Genetics, temperament, disrupted sleep, chronic stress, loneliness, medical or hormonal issues, loss, rumination, and repeated small disappointments can stack together until finally the system tips over. None of these factors alone cause depression or anxiety, but together they can overwhelm a person who's never been taught how to respond to them in healthy ways, which is most of us. We don't intuitively know how to process everything life throws our way. They're states of being that develop when several pressures converge without the skills needed to manage them. For example, someone may have no obvious trauma history, yet over time they take on increasing responsibility at work, they start believing they have to get everything right, they begin to worry about the future. Nothing big really happens. There's no single moment to point to. In other cases, a person does experience a very intense traumatic event. And then there are people who live with multiple ongoing, even generational forms of trauma. This can include environments shaped by instability, abuse, repeated loss, discrimination, or chronic stress. In these situations, both the nervous system and the mind adapt in ways that are understandably protective. The body may stay alert, cautious, and vigilant, while thinking patterns develop that prioritize safety, anticipating danger, and scanning for threat. These experiences all look unique for each individual, and the suffering manifests itself differently. Phobias, PTSD, generalized anxiety disorder, apathy, depression, feelings of worthlessness, or any combo of these. Yet beneath the differences, something important is shared. In each situation, the mind and body are doing their best to adapt to all these pressures, using the tools and patterns they've learned so far. Depression and anxiety don't appear because someone is weak or broken, and they don't require a single dramatic cause. Here's the good news. We don't have to figure out every detail that caused or more accurately contributed to depression and anxiety in order to recover. We don't heal a broken leg by endlessly analyzing a hiker's mistakes or all the factors that led to the fall. The bone won't heal just because we figured out trail maintenance was poor, or weather was bad, or GPS lost signal. No, we focus on trauma care. We set the bone, stabilize it, and support the body's ability to repair. If the hiker's willing, we might later work on balance, strength, and techniques to reduce risks of another fall. But those steps aren't required for the bone to heal. Psychological recovery works the same way. Healing doesn't require erasing the past. And that's good because we can't. Now, a brief understanding of what happened can inform treatment, but the treatment itself focuses on addressing what's happening right now for this person. One of the most important distinctions we can make is the difference between how something started and what keeps it going. Two things that often are confused when it comes to depression and anxiety. Think about someone who's developed migraines. They may or may not be able to trace their first migraine to a period of extreme stress, illness, or a hormonal change. Regardless, the migraine continues not because the original stress is still happening, but because there are ongoing triggers, sleep disruptions, tension, or sensory overload, and that keeps the system hypersensitive. Now, it's possible the initial cause is still ongoing, much like in situations where someone is in an abusive relationship, and we definitely have to deal with that. But that's very different from addressing the depression and anxiety. Let's consider diabetes, kind of another parallel. We don't treat diabetes by endlessly analyzing a genetic predisposition or lack of good nutrition as a child. Treatment focuses on what regulates blood sugar now: nutrition, activity, sleep, and stress, and possibly medication. Depression and anxiety work much the same way. What keeps people stuck are present day feedback loops: rumination, avoidance, disrupted sleeping, narrow thinking, and learned patterns of self criticism or hypervigilance, among other things. This is why insight alone, while often meaningful, rarely produces full recovery. Understanding how you got to feel the way you do does not change how your mind and nervous system operate on the day to day. This is where many well meaning therapies accidentally stall people. By focusing so heavily on exploration and explanation, they reinforce the negative pathways while never fully engaging the repair mechanisms that actually restore emotional health. I've had clients who've claimed they got worse because of ongoing talk therapy by well meaning, but not evidence based therapists. But I digress. Trauma matters. It informs our compassion and helps us to honor people's stories through empathy. And sometimes it's helpful to understand what happened to inform treatment. But what really matters is the now. What are we thinking about what happened in the past right now? Effective therapies don't reverse the past. They dismantle the feedback loops right now, present day, distorted thinking, ruminations, and they build skills that make future episodes less likely. When given durable cognitive and behavioral capacities, many people don't merely cope with depression and anxiety, they become depression and anxiety free. Okay, so If recovery isn't about endlessly unpacking the past, what does help set the bone? Well, let's think of the various breaks a human body could suffer. Minor fracture, simple cast, few weeks of rest, and you're good to go. But get a compound fracture with a break in the skin, now we have increased risks of infection. The doctor will want to keep the access open to allow for swelling, drainage, check for inflammation, and watch carefully for healthy tissue growth. There may be several casts or even none at all. My husband broke his finger a few weeks ago getting firewood. The injury also included the loss of his nail and a very mashed up fingertip. He was very grateful there happened to be a surgeon on at the small ER, which isn't usually the case. We had to keep a careful eye on the open wound for infection while still immobilizing the finger so the bone could heal. So, no cast. Whereas when I broke my wrist snowboarding, I was in a cast within a few hours and it healed up without much intervention. Different injuries require different techniques for healing. Rather than focusing on how the fall happened that broke the bone, it's better to look at what kind of break so we know the procedures to facilitate healing. Healing happens when we work directly with systems that are stuck right now. We need to identify the break, so to speak. Is it thinking patterns? Are there behavioral changes the person has made? Is there relationship damage? What is causing this person's suffering? Are there cognitive distortions, emotional regulation issue? There's several different kinds of breaks, and we can have more than one. Let me give you an example. This will be a mashup of a few clients to protect identity, but let's call her Sally. At 13 years old, Sally almost lost her 10-year-old sister to undiagnosed epilepsy. It was quite traumatic, as her sister almost died in the middle of the night and had to be rushed to hospital. A lot of time over the next several months was spent trying to figure out what was wrong and subsequently making sure she was safe every day and at night. Sally became very protective of her sister. Years later, Sally has had trouble sleeping or moving out of the area as an adult. Her sister wears a monitoring device in case she falls, and Sally is the medical contact. She worries about her sister, and she at times feels very exhausted, worried, upset, anxious, and even panicky at times. Her thoughts are things like, I can't live without my sister. It'll be my fault if she has an episode and I'm not there to help her. She'll never be safe. These thoughts and feelings are the break that needs healing, so to speak. We can't fix her sister's health issue, and we don't want Sally to give up on helping and being part of her sister's life. But we can adjust the story Sally is telling herself about the situation. We can help Sally with tools to manage the stress of being a caregiver, to honor the emotion she's experiencing, and provide some tools to maybe dial down the intensity of the concern and worry she has. We can even use tools to help her see how positive and helpful some of her anxiety and worry is. Maybe she can hold on to some of that worry without it burdening her and making her miserable. That's exactly what I did in working with Sally. We used several tools and approaches to tackle these very areas. Different approaches can be helpful, and we shouldn't limit ourselves to only one way, nor are there specific tools for specific traumas. Rather, we can create a toolbox from several approaches that house various tools for individual needs. Nothing gets my goat more than people saying, what can you do for X? Thinking that if they name a specific condition, I have a set of tools that'll work for that condition. But tools work for people, not disorders or conditions. And that's where our analogy breaks down. Because while there are specific healing modalities we use for different breaks in a bone, it works a little differently in mental health where we are working with the person and their thinking patterns rather than specific symptoms that come up for them. So we need to mix and match the tools to the needs of the person. CBT and other approaches that focus on thinking patterns help people to learn how to identify and challenge distorted thoughts, catastrophic predictions, harsh criticisms, all or nothing thinking. And things that quietly fuel anxiety and depression day after day. When people learn how to respond differently to their thoughts instead of automatically believing anything that comes into their head, emotional intensity often drops quickly. Some approaches, like rational emotive behavior therapy work directly on the beliefs underneath our thoughts, those rigid musts and shoulds that quietly fuel anxiety and depression under the surface. Other approaches focus more on behavior. Depression and anxiety shrink people's lives, and people stop doing things that once gave meaning or momentum to their life. Behavioral tools help people gently re enter life, one small doable step at a time. Some tools work directly on physiology, sleep, exercise, breathing, recreation in nature. All can help the nervous system regulation. When sleep improves, when bodies move regularly, when stress hormones have a chance to dissipate, emotional resilience often improves. And we often see an improvement in cognitive function as well. There are also approaches that help people work with attention and rumination, learning how to disengage from repetitive mental loops that feel productive but actually keep them stuck. And for many, meaning and value and faith are an essential part of their healing journey. What matters most isn't the label of the modality. What matters is whether the approach helps a person learn new ways of thinking, responding, and recovering in the present. Whether it reduces avoidance or restores agency, whether it builds skills the person can use at 2 a.m. when they start ruminating and having anxiety, or a Monday morning when a blue day hits and depression tries to do its little con artist job. People need different combinations of various tools. Some need more structure, some need more encouragement, some need faith integrated carefully and respectably. But the common thread is this: recovery happens when we actively engage the systems that are maintaining distress now, not when we simply just understand where they came from. Real recovery involves a system level change. We aren't looking for people to just feel a little better. We want to have a deep, meaningful shift in thinking that counterattacks the negative messages from the past that are present right now. Healing isn't about replaying the fall or what led up to it. It's about setting the bone, rebuilding strength, and stepping back onto the trail.